Assalamualaikum and hi to the doctor and my fellow friends. I'm Dr. NATASHA BINTI MOHAMAD KHAIRUZZAMAN, BM 24110057. Today I'm going to talk about the human skeletal system, but I'm going to focus at spine. So the lesson objective for this topic is I'm going to talk about anatomy of the vertebra, disease and the treatment related to the spinal column and the specialist in orthopedic. So let's explore the anatomy of the vertebra. Spine consists of 33 vertebrae and can be split into two categories, which is 24 mobile and 9 fused. For the 34 mobile articulate together, which is 7 cervical, 12 thoracic and 5 lumbar. And for the 9 fused include the 5 sacral and 4 coccyx. So the 25 mobile make up the superior portion of the spinal column, which is cervical, thoracic and the lumbar. So for the 9 fused vertebrae make up the inferior portion of the spinal column, which is sacrum and coccyx. So let's look at this picture. We can see that from the first we have the cervical, and the second part we have thoracic, and the third part we have lumbar vertebrae, and fourth part we have sacrum, and the last one we have the coccyx. So this is the anterior view of the spine, and this is the right lateral view of the spine. So let's go to deeper, and for the posterior portion we have a cervical from the C1 and the C7. The location at neck, and it helps support the head. So next, thoracic, we label it from T1 until T12. It located at the mid upper back and help hold the rib cage. So the less mobile than the cervical and the lumbar vertebrae. And for the lumbar, we label it as L1 until L5. It located at the lower back and have a large in size. Why? Because it's to support the rest of the body. So the easy way to remember these three is you can remember the breakfast, lunch and dinner. For the breakfast is 7 a.m. We actually have breakfast at 7 a.m. lunch at 12 p.m. and the dinner at 5 p.m. So we can remember for 7 a.m. cervical, for 7 cervical, 12 thoracic and 5 lumbar. So next we move on to the inferior part. At the interior part we have sacrum, which is the 5 connected bone. It connect at the hip bone to form pelvis. As you can see, this one is the sacrum. For we label it as S1, S2, S3, S4 and S5. For the coccyx is a fused 4 bone, which is we call it SO1, SO2, SO3, CO1, CO2, CO3 and CO4. It's fused together. So that's one. Again, you can see this cervical, thoracic, lumbar. Okay, next we move on to the intervertebral disc, which is located between the edge of the mobile vertebra, a section between C1 and C2. What we call the C1 is atlas, and the C2 we call the axis. So it consists of two main components, which is annulus. Annulus is made up of fiber that crisscross and help hold the vertebra body together. And for the nucleus, this is a gel-filled sac that pushes vertebra body away from each other. Okay, so we go to the characteristic of um, each vertebrae. As you can see, this for the cervical, it is shaped like this, and for the thoracic, it's shaped like this, and the lumbar, it is shaped like this. Okay, we focus on the body and the vertebral foramen, which is located at this one and this one. As you can see, it's a very different shape for each these of three. So for the cervical is small and wider. For thoracic is more likely a shape, heart shape, and lumbar is massive and kidney shape when we view at superiorly. So the vertebral foramen is larger and triangular. For the thoracic, vertebral foramen is circular and smaller than cervical and lumbar. For the lumbar, it's triangular and larger than in thoracic but small than cervical, which is larger than thoracic but is small than cervical, which is at intermediate size lah. So move on to the concept of vertebral. So we have thoracic. As you can see, thoracic and sacral kyphos are concave anteriorly, which is this one. As you can see, yeah. And for the cervical and lumbar lordosis are concave posteriorly, which is this at the neck and at this lumbar region. So the function of this curvature is provide additional flexibility and shock absorbing resilience. So what is the function of spine? Function of spine is for structural support. The spine support the body and allowing to stand upright. So the second one is to protection. It's protect the spinal cord, which is a column of nerve that connect the brain to the rest of the body. So the third one is flexibility and movement, which is spine allow for a wide range of movement and flexibility. The intervertebral disc between the vertebrae allowed for bending and twisting. For the last one, stabilization is help stabilize the rib cage, which in turn to help stabilize the thoracic spine and together protect the heart and the lung. So you next at the what a condition related to the spine. So I choose kyphosis. Kyphosis spinal disorder in which an curve excessive curve of the spine result in an abnormal surrounding of the upper back. So we have three type of kyphosis, which is posterior kyphosis, Sherman kyphosis, and congenital kyphosis. As you can see at the picture, this one is Sherman kyphosis, as you can see, and this one is for congenital kyphosis. So for the posterior kyphosis is the common type of kyphosis and usually become noticeable during adolescence. It is noticed clinically as poor posture or slouching, but is not associated with severe structural abnormality of the spine. The curve typically round and smooth and can be often be corrected by when the doctor asks the patient to stand up straight. Yeah, it is more common in girls than boys. It's really painful, and because the curve does not progress, it does usually lead to the problem in adult life. So we move on to human kyphosis. The name is named after the Danish radiologist who first described the condition. More often becomes apparently during the teen years, can result in more severe deformity than osteokyphosis. Human kyphosis is caused by structural and abnormality in the spine. In a patient with human kyphosis, an X-ray from the side will show that rather than the normal rectangular shape, three or more conservative vertebrae have more triangular shape. This irregular shape cause the vertebra to wedge together toward the front of the spine because the normal disc space and creating exaggerated forward curvature. As you can see, it's like a more triangular shape at this point. So we move on to congenital kyphosis. It's present at birth. It occurs when the spinal column fails to develop normally while the baby is in the womb. The bone may not form as they should, or several vertebrae may be fused together. Congenital kyphosis typically worsens as the child ages. So it's more of the symptoms. When patients have kyphosis, we can detect by it has rounded shoulder, visible arm, mild back pain, fatigue, spine stress, tight hamstring, weakness, numbness, and tingling in the leg, loss of sensation, change and bowel and bladder heavy, breathing difficulties, and usually doctor um, use Adam forward bend test to examine patient with kyphosis, which is we ask patient to bend forward with the both feet together, knees straight and arm hanging free. And the doctor able to see better the slope of the spine and observe any spine deformity. So the next we have a treatment. Treatment for this kyphosis is we divide to two for non-surgical and surgical. For the non-surgical, we have observation, which is for non-surgical is recommended for posterior kyphosis and human kyphosis who has curve less than 70 to 75 degrees, which is we have observed the patient. The doctor will observe the patient to simply monitoring the curve to make sure it does not get worse. For the next is physical therapy. Specific exercise can help to relieve back pain and improve posture by strengthening muscle in the abdomen and the back. For next, we have non-steroidal anti-inflammatory drug, which is including aspirin, ibuprofen, and naproxen that can help relieve back pain. And lastly, we have bracing, which is recommended for patients human kyphosis who are still growing. The specific type of brace can and the number of hours per day it should be worn will depend upon severity of the curve. Patients wear the brace until they reach skeletal maturity and finish growing. Which is, as you can see, this the brace is very make a difference after wearing the brace. For the surgical, we have a spinal fusion, which is recommended for patients who have congenital kyphosis and human kyphosis who have curve greater than 70 to 75 degrees, or those who have severe back pain. And the spinal fusion commonly a surgical procedure used to treat kyphosis. So the goal of the spinal fusion is to reduce the degree of the curve, prevent further curve progression, maintain the improvement over time, and alleviate significant back pain if it's present. So, lastly, I will talk specialist in orthopedic, which is Dr. Prof. Dr. Datuk Prof. Dr. Tunku Sarah Binti Ahmad Yaya. He is the one who involved in the orthopedic field. Okay, thank you for listening, and for my resource is KL. Thank you.